Thank you, Devin. And there are a number of illnesses that we go through in our early years of development. Several have been numbered according to their amount of occurrences. And Nurse Christina Paris is joining us this morning to break down a few that we should probably keep our eye on. So thanks for coming in this morning.
Absolutely. We're here to focus on the kiddos this morning.
Yes, it's for the youngins today.
That's right.
Well, let's get right into it. So what is hand, foot, and mouth disease, and who's the most at risk? I'm guessing the younger ones.
Right. So all of the ones we're going to talk about this morning, we're going to talk about 3 of them, and they're all rash-based viral infections. And so yes, hand, foot, and mouth typically affects children under the age of 5. It of course could affect anyone, but many of us have already experienced it. I have found though, my mother and people in our parents' age, well, maybe not yours because I think your parents are my age, but up one, we're not familiar with hand, foot, and mouth, and that is because it really wasn't around until around 1962. So it sort of missed that generation. They had the mumps, the measles, things like that we now have vaccines for.
Okay.
But you, when you were a child, would have probably experienced hand, foot, and mouth.
What a joy.
Yeah, and so we will go through briefly some of the symptoms. So what you're going to see with most of these is that this particular illness can last 7 to 10 days. And you're going to see a fever, sore throat. There might be painful blisters that can occur in the mouth. Ooh. You can get that with chicken pox too. However, we don't see chicken pox as much because of the vaccines. And then you get rash that can occur on your hands and feet, hence the name hand, foot, and mouth. It of course does have some fancy viral name to it too, but most people just refer to it that way. And complications to this are pretty rare. Kiddos pretty much just kind of ride it out and do okay with this one. So there's
nothing really, that can be done about it. You just kind of, manage the symptoms, get through it, and do the best you can.
And they're all similar. So once we go through the other 2, I'll review just basic treatments for all of them.
Well, let's move on to the next. I think it's the 5th disease, or the parvovirus B19.
Right, which, I've heard of 5th disease. I didn't really realize it was a parvovirus. And now that I have a young puppy who got parvo. And so I didn't realize there was a human form of the parvovirus, but there is. And so, yes, it's one that we're going to watch for. This one can affect anyone, so all ages can be affected. And again, you're going to see a fever, headache, cough, sore throat, and the rash. The rash can be on the chest, arms, legs, and this particular one can be itchy. So you might itch and scratch. Again, can be confused with chicken pox, which is also very itchy. But one of the differences between this particular virus is that it can cause joint pain as well. And that's something we see also, the rash and joint pain with Lyme disease. So a lot of these are very different. But you can do a blood test to test for this particular virus. So that's a good thing. If you are an adult or something, you do have the rash and you do have the joint pain, go in and talk to your doctor, because they'll probably run the Lyme test, but they can also check for this as well, especially if we're seeing it in the area.
Well, that'd be really helpful. But all right, the last one we got here is the roseola.
Right.
And how's it distinguished from the other ones that we talked about?
So roseola is called the 6th disease. So it was the 6th highest one. This one too, it will have a fever that can last 3 to 4 days. Very high fever. So right away you're going to get a high fever, 103 to 105, and then the fever goes away before the rash. And so that kind of distinguishes it from the others. Hand, foot, and mouth, the rash, the fever go together. Same with the parvovirus. But with this one, you're going to have the fever will go away, and then the rash will break out. This particular fever, this particular virus is what causes 45% of childhood fevers
Wow.
come from this. Yep. But again, they're going to have the loss of appetite, the vomiting, the diarrhea, the,
that sounds like a
cough,
very
sore
common
throat.
occurrence
Right.
during
Just
the young and
feeling really,
Yeah.
really punky, but you're also going to have that rash. So watch for that. So with these, like you said, so all of these are viral. That means there is no antibiotic that's going to help.
Just
Antibiotics, again, are for bacterial infections, won't help a viral infection. So it's going to be symptom relief. Big thing is washing your hands. Wash your hands when you're changing diapers, after changing diapers, wash your hands and wash the kiddos' hands. Make sure you're cleaning surfaces. So common surfaces, toys, things like that the kids use. You can throw them in the bathtub with a little bit of bleach, water that can help, or just hot soapy water to clean. Avoid close contact. So if your kiddos do go to daycare, unfortunately, these are ones they're going to want you to stay home because it can affect other kids. And you really want, I know it's so frustrating when your kids are sick and you have to be at work, and I get that. But if you expose other kids or other people, there could be someone who is immunocompromised, and that can cause really big issues. Or they might have little newborns at home, and so those too can cause really issues, so you want to do that. They don't want you to return to daycare or school until you're fever-free for at least 24, 48 hours.
Reasonable.
And again, good hand washing. Now, big thing is treating the symptoms. So fever, you want to reduce the fever.
Right.
If your child is really young, you want to make sure that you're talking to your doctor about medications, because some of them aren't approved for kids, like under 6 months. So make sure you're talking to your pediatrician to make sure that any medications that you want to give for fever reducing is appropriate and at an appropriate dose. Also, if you're giving medications to help with symptoms like sore throat, headache, cough, things like that, make sure that the medications you're giving don't include like Tylenol if you're going to give Tylenol, because that can overdose. So read all of the ingredients in those medications, again, talking to your provider. Loose, lightweight clothing, we want to bring down that fever. You can do medicines and push fluids. So
always
kids
good to
can
stay
go
hydrated.
without food, but we really need the fluids. And again, talk to your provider.
Always good advice there, and hopefully, everyone's little ones can,
Yes.
get better, get
know.
healthy again, and they can get back to doing what they do.
Right. Nobody wants to be sick. It's hard when you see those little kiddos all punky.
Thanks for coming on this morning and talking about this.
Absolutely.
Always good heading into the cooler season.
Right.
Gotta be on alert for these ones.
We are, and we're seeing them come out right now.
Boy.
So,
Well, thanks again.
you're welcome.
So, coming